Hi everybody, Dr. Spiro here. We're here with another episode of our podcast. I am so excited today to have one of our patients who recently had surgery as one of our guests. Jennifer, thank you for being so gracious and for coming.
Thank you for having me. This is such a pleasure and an honor.
So we're going to talk about Jennifer's surgery and her experience here, and I want our listeners to really get an understanding of the practice from our patient. So I'm going to ask Jennifer a number of questions about her experience here. So Jennifer underwent my version of a high SMAS deep plane facelift with central cervicoplasty, lateral platysmoplasty, upper and lower eyelid blepharoplasty, fat transposition, cheek lift, and it sounds very complicated, but Jennifer looks amazing. Jennifer, what made you start thinking about having a facelift?
I always loved what I looked like, but I just felt that over, I don't know, in the last 10 years, I've aged a lot and my face didn't match my body. And I just felt that, I needed something, and I've done chemical peels and I've done other things, and nothing was really improving. And, I felt like I was wearing my age.
Got it. And how long had you really started thinking about surgery as a solution for the facial aging?
Pretty much when I knew that I had exhausted any type of non-surgical techniques, because I've had Ulthera before, and I've done that a couple of times. I knew the chemical peels weren't working, microneedling, vampire facial. I've had all of those things that were collagen building, and it wasn't working. And I felt that I saw a lot of the skin, sagging skin, which I knew that there was nothing that was really going to work for that. And surgery was really the only option.
Now, it's a lot more sophisticated for patients in decision making now than ever before, because a lot of surgeons are touting different types of solutions in facelifting. So I specialize in my version of a blended bilaminar separating the tissues, high SMAS deep plane facelift. What made you choose me?
I was very diligent with my research. I went and looked at some of the different surgeons, some of the other well-known surgeons, and was looking at their photographs. And in their photographs, I was looking at the surgical lines. I was looking at the way that the face was pulled. I looked at, yes, before and after. And you always have to assume that somebody is going to put on the best of photographs or whatever it may be on their websites. So I've looked at the Instagram, but then I just kept looking at certain ways and like the repetition of the way that certain surgeons did things, whether it be just like the mini facelift. And what to my eye was I didn't like the pulling that came with certain techniques.
So you were focused on, you wanted to preserve a natural outcome.
Absolutely.
But get a maximal outcome, but still
Correct.
end up on the other end looking natural.
Yes, I wanted to look like myself. I never did not like what I looked like. That was never something with me. I wanted to be refreshed. I wanted to feel 20 years younger. Well, I feel 20 years younger, but I wanted to look 20 years younger and match the way I felt.
Okay. So let's start with the consult. So when we met to go over your surgery, I pride myself on being very, very thorough and evaluating the patient, but just tell our listeners just about our consultation process.
Well, you were very calming. We'll start there, because anybody that's going in for surgery, especially for a facelift, it's nerve-wracking. It's scary. It's, what are you doing? This is going to be a big change. And the fact of being able to, look at your doctor and be like, I have all the faith in the world in you, and you're just scared because you don't know what is going to happen. So you definitely calmed my nerves with all of that. We went over everything. You told me everything that was going to happen, everything that that I needed to look for, like even as far as with the eyes, with the surgery, you told me about them being closed shut. Those are things that a patient needs to know. And then you can go home and you can think about it, and then you allowed me to come back with more questions.
So that's an important part in our practice, is that we bring patients back for a second visit. We call it a discuss appointment, where we do a refresher and get usually like a week or a couple of weeks before the surgery. And did you find that to be helpful and calming?
Absolutely. Absolutely.
Okay. So then it comes to surgery, but before that, so you had all your questions answered, and how about our staff along the way, my great nurses?
Everybody's wonderful. You have an amazing, amazing staff, excellent, superior, very attentive. If there was a problem and I had any issues and I would call, they would get back to me, immediately. So
Okay. Now let's go to the day of surgery. So the day of surgery comes, and I do the surgery at the hospital. I think that's very important, especially nowadays for big operations. Patients like to feel well taken care of. I think there was a push away from that. Now there's a pull back to that. Patients are realizing the value in being in a hospital setting rather than somebody's office. And even with our face and neck lift patients, we have them stay there overnight so that we come and see you the following morning. So the idea of that, was that comforting to you at all?
Oh, absolutely. Because you never know what to anticipate the first night. I mean, the first 24 hours of what type of pain you might be in, or, you don't know what to anticipate if there's bleeding or not bleeding. You don't know.
Right.
So the fact of having a medical staff, by being in a hospital, you know that you're safe.
Now you're 3 months out.
Yeah.
But let's go back to the beginning of recovery, because you look incredible. Maybe
you.
20 years younger. In fact, somebody recently said they knew you in high school, and when they saw you recently in your recovery, they remembered you from high school. And that's what I try to capture, the essence of who somebody was. I want to bring them back in time to themselves. Like you said, what you saw, it was just aging. So I wanted to keep all those great things in your face and neck and eyes, the essence of you, and just bring you back in time, reset your time clock set point.
Absolutely.
So, but the recovery initially is not like that. So we did a lot of surgery.
Yes.
And with a lot of surgery, you don't look like this 3 months later on day 1 and day 7. So
Day 30.
take our listeners through just what the beginning, the first week of what recovery was like.
So the first week, the first night you spend in the hospital, it was great. They gave you the pain meds and the Tylenol. The first day home, it felt so good to be home. But I can't say that I was really in any pain. I mean, I took Tylenol the first maybe 3 days, maybe 4.
Right.
Every 8 hours around the clock, like you had suggested. But you didn't need anything more than that. And after that, I wasn't taking anything.
Okay.
So pain-wise, I didn't feel that there was any significant pain during the facelift procedure and the post-op.
Now, I tell patients before surgery, I tell patients, it's not painful to experience, it's painful to look at.
That's why I'm laughing.
And especially whoever the primary caregiver or helper is, oftentimes I tell my patients, get your mom or a girlfriend to help you in the first couple of days. Who did you invoke to help you out initially?
I had my mother come and stay with me, and she stayed with me for a week.
Yeah.
And you definitely need to have
You
somebody.
need somebody, because you can't do this surgery and be alone, and not in the
No.
first,
And it's
not in
like
the
I
first
said,
week.
It's not because of the pain,
Right.
but you need the emotional support.
Right.
You really need the emotional support. I mean, I know that you had said to me, Jennifer, when you look in the mirror, you're going to say, oh my God, what did I do? I said that, oh my God, what did I do? Probably for a solid month. You know, and then I had to walk myself off the ledge. And I feel that this was like a part that was really missing in just the lack of knowledge on me, is that you have to be kind to yourself. You have to trust the healing process, and you have to have faith in your doctor. And those are three really big things. So, you know, you're going to heal. It's going to take you time. You go through an invasive procedure, and I'm the type of person that I'm going to do it tomorrow, but I wanted it done yesterday.
Right.
So I also wanted my healing done yesterday. And here I am 3 months out, I'm still healing.
Right.
And
Now, unlike other places where you have surgery, you don't really have significant follow-up, we pride ourselves in our practice, particularly in face and neck lift and eyelid patients. It's a lot of concentrated care. We see our patients a lot. You were seen here
3 times a week, I think.
3 times a week in the first week or 2 weeks, because we want to make sure everything is just right. And kudos to my great nursing staff, because
Yes, your nursing staff is
yeah,
wonderful.
yeah, they're fantastic and very knowledgeable. And that had to be very comforting and supportive for you to be here so frequently with eyes on you, that you knew that if there was anything that wasn't healing just right, we would know
It
that
would be addressed
and
immediately,
intervene.
yeah.
All right, so that's the early healing. And let's talk about now. You're 3 months out. You said you're still healing. But overall, let's talk about reflecting back on your decision to have surgery. What are you thinking now that you're coming out the other end of things?
I should have did it sooner.
So,
I should have done it sooner.
So that's what I
No,
tell patients. I say at the beginning, when somebody has a face and neck lift at consultation, I tell them, I say, initially after surgery, you're going to regret having, why did I do this? Why did I do this, choose to do this to myself? And with all that regret, and then a couple of weeks, or in your case, a month later, you then say, why did I wait so long to do this?
Oh, absolutely.
So, yeah.
Absolutely. And it's, you know, with the healing process, I always felt that it was amazing that every day you wake up, it's different.
So
Every
we're
way.
3 months out. What are reactions from people looking at you, or those that you know or maybe don't know as well, or haven't seen you in a while? What are those reactions? I'm always curious about
Well,
that.
my family thinks they're over the moon. They think that I look like I did 20 years ago. Like, oh my God, my mother looks at me. She goes, "You're like my Jennifer when you're 20 years old."
Yeah.
And,
That's
you know,
see, now that the psychology of that is what I'm after. Like I said, to me the holy grail in facial rejuvenation is not make somebody plastered, pulled, weird looking. It's to bring out the original youthfulness and beauty of who they were and maximize how we can get back to that set point of their younger years in all the various things. And what in my version of this operation, it's all the little nuances, of which there are many, that go into it, because you can't just go in and pull somebody tight, or say you're doing a deep plane facelift and think you're going to get somebody looking 20, 25 years younger. They're just going to look weird or pulled oddly.
Right.
So,
right. I mean, it's funny.
so that's an interesting psychology of how people are looking at you.
Yeah, even people
And
like
that's what I'm after.
So that's my family. Now, people that know me but haven't seen me will just look at me, and they just look, and I'm laughing on the inside because I already know what they're looking at, and they're like, "Wow, you look fantastic." I'm like, "Thank you." And I don't come out and say, "Oh, well, I just had a facelift."
Well, because
I had all these things.
And again, another thing that I'm after, it doesn't look like everybody's facelift. So when somebody looks at you and you see that sort of quiet, they're looking, it's not registering. If they knew you before, they're like, this person looks like they look like it registers as this person, but from 20 years ago. So there's so many little things that bring you back to that youthful appearance that somebody looking at you subconsciously, they can't see it as a facelift. They just don't know what it is. They can't, and to me, that's the perfect operation.
Absolutely. Even 3 weeks, because that's when I went back to work, 3 weeks. And I was still healing significantly in 3 weeks. I had people looking at me and where I work and just saying that they love the results. So they knew what was going on there. And they were just like, oh my God, I need to book my facelift. I need to look like this. And, you know, people raved. They love the results. I love the results.
So thank you. I appreciate it. You're a pleasure to take care of. And again, you're so gracious to come sit with us in this podcast and explain to people. I often find it funny when we ask patients who have tremendous results if we can use their pictures on our website to demonstrate the work that I do, but also educate future patients. And when some patients who I've taken back 25 years younger say, well, I don't want you to use my pictures because somebody is going to know I had a facelift. And I look at them and I say, you don't think people are going to know
Of course.
you've had this done? You look 25 years younger.
100%.
So, now that you're on the other end of this, 3 months out, and your healing is mostly complete, what words of advice could you give people out there listening to our podcast in preparation and how to select a surgeon and recovery?
I think that you should feel comfortable with your surgeon. You have to be able to have a good rapport with them. I feel that everybody should research and do their own due diligence. They need to do that. They have to be very secure with who they decide to go with. As far as recovery, you have to be kind to yourself and you have to give yourself time. And there's going to be results that you're going to see during your facelift because we don't heal the same rate, one side and the other side, and things will be different. And you just have to understand that it just takes time. So you have to be kind to yourself. And I think and be patient.
I like that. You have to be a patient.
100%.
Yeah.
100%.
Well, I couldn't be more thankful that you've come to discuss this. So for our listeners, I hope you gained a little insight in the world of face and neck lift, particularly my version of bilaminar high SMAS deep plane facelift, together with all the other things I do to embellish the operation and restore youthfulness in a natural way. Thank you.